When we see patients in our clinic who is coming for test tube baby, one of the common queries is what's IVF and what is ICSI or intracytoplasmic sperm injection, and what the difference between them, which one is better, because they do a lot of research online, and then they get a bit confused about why they will have ICSI or why they will have IVF, why they can't have both, etc. Now, today I'll explain you more in details about what is IVF, what is ICSI, why we do ICSI, and what are the risks of the procedures, etc., etc. Now, in IVF, what happens once we collect the eggs from you, we mix the eggs and the sperm in a petri dish, and the sperms, they fertilize the egg on their own. So it's a natural fertilization process. But in case of ICSI, what happens is that we get the egg, and then we select the best available sperm, mature motile sperm, if we get that, or a live sperm, and then we inject the sperm into the egg, and then it gets fertilized. So here the embryologist is selecting a sperm and is injecting that into the egg. Now, why we go for ICSI and we can't do IVF in certain cases? The indications of ICSI are, if the number of motile sperms are very low, that means the chances of spontaneous fertilization of the egg with the sperm is low, we go for ICSI. Or the morphology of the sperm is not good, it's a poor morphology sperm, that means the sperms are defective and it may not fertilize the egg, then we go for ICSI. Or there is a prior fertilization failure, so you had an IVF before and none of the eggs fertilized when they were mixed with the sperm. In the next go, when we we go for ICSI, because the chances of fertilization in ICSI is much more than IVF, though the pregnancy rate is the same. Or in case when we go for a surgically retrieved sperm, that means the man doesn't have the sperm, and we are getting the sperm after doing a small surgery like TISA or TZ, that means making a small nick in the scrotum, and then we retrieve the sperm from there, from the testes. So we have a very limited number of sperm, only few sperm. In that case, we have to do ICSI, because the number of sperms are very less. Or if there is an unexplained infertility, we don't know why the couple is not falling pregnant instead of everything being normal. In that case, to increase the chance of fertilization, because we thought that fertilization can be a problem, we go for ICSI. Or if the sperm was frozen at an earlier date, and when we thaw the sperm, we see that only few sperms are there. Okay, in that case, to avoid fertilization failure, we go for ICSI. Or if you want to go for a genetic testing like pre-implantation genetic testing called PGD or PGS, in that case we have to do ICSI, because if we go for IVF and there are quite a few sperms adhered, then we don't get the best result. So we go for a single sperm fertilization, and ICSI is a procedure of choice. Or in certain conditions like problems with sperm binding to and penetrating the egg, or there is a lot of anti-sperm antibodies, in that case ICSI can be a better option. Now, if we compare to IVF, the fertilization occurs in around 50 to 80% of the injected egg in case of ICSI. But there is a small chance that the ICSI may damage the egg, or even if the procedure is perfectly all right, then the eggs may not fertilize, or even if the egg fertilizes, the embryo go for a couple of days and then the embryo gets arrested. So in that case, though the procedure of ICSI is quite successful, but at the end of the day, we are not getting a good quality embryo. So if we compare between IVF and ICSI, the fertilization rate of ICSI is more than IVF, but the pregnancy rate between IVF and ICSI is same unless there is a gross male factor abnormality. Now, what are the factors that can affect the success of the ICSI. It's mainly the quality of the egg, the quality of the sperm, the expertise of the embryologist who is doing ICSI, and the condition of the lab where the whole procedure is done.